we celebrate heart health here at ABC 15, and of course, it's Rally for Red Day, and as always, we partner with Mayo Clinic to bring you the latest in heart health. Mayo Clinic cardiologist Dr. David Fortune joining us this morning to tell us about some new treatment options that are available to patients with heart failure, and it's good to see you. Welcome back.
Thank you.
I always love it when you come in because you make this very, very simple for us. So first of all, really define heart failure. What is it? I know it might be a big definition, but what does it mean, basically?
We brought the heart model.
Okay.
And I mean, the heart's a very complex organ.
It is.
A lot of structures. We have the heart muscle itself. We have the arteries to the heart muscle. You have 4 big valves. You have a conduction system. Any one of these structures can fail, and that can cause heart failure, which is basically the inadequate function of the heart where it can't supply the blood or the nutrients to the rest of the body, so the person can't do what they want to do.
So any one of these would be heart failure, would be considered heart failure?
Could cause heart failure, that's
okay,
right.
Let's take a look at, you gave us some information, and this is easy to follow, but let's take a look in the monitor here as to what you see when you have a patient come in. What are we looking here to the left of our screen?
So these are some images we got from Dr. Gotway, one of my colleagues, and this is an MRI, and I thought it would be good to show some of the newer imaging technology. You can see how really awesome the imaging is here. So here you have a slice through a person's chest, and this is a cross-sectional area through the left ventricle, and you can see how the heart is contracting nice and vigorously. During the heartbeat, the muscle contracts and pumps the blood, where here, this patient has heart failure, so a form of heart failure, systolic heart failure we call it, and the muscle is not contracting adequately to pump the blood.
So in this case, it's muscle, as opposed to any other type of issues where it could be a valve or a leaky valve, as you had mentioned in the past. When it comes to treatment options, what are some of the options that we have available to us today? Because technology, every day, it's changing.
Right, and it depends what the problem is. So if it is a valve problem, an aortic valve problem, then we look at the aortic valve, or replace the aortic valve. And we've been on the show before, and we show the minimally invasive procedure, the TAVR procedure.
Right.
Or this is an example of a patient who has these white dots are calcium. So there's a calcium buildup on the aortic valve, and this can restrict the leaflet so they can't open.
Oh my goodness.
So we go in and we either have our surgeon replace the valve, or if they're not a candidate for surgery, they may be a candidate for the minimally invasive catheter-based procedure, the valve replacement. Okay.
And before we get to some of those treatments, real quickly, what would be some of the causes for, I know there's lots of different types of heart failure, but what are some of the major causes? What can people be doing right now to avoid heart failure? Well,
as you always preach.
No, not me, you.
No, but you know, moderation, right? Alcohol moderation, no tobacco, no smoking, obviously. Daily exercise, eating a balanced diet, watching our caloric intake, using more calories than we're taking in. All those are critical for heart health.
And good thing, because on the show later we're talking about all of that with heart health and exercise. But real quickly, Dr. Fortune, explain to us, this is a treatment option that you do, and explain that to me. What is this?
Yeah, we're coming at you with a lot of different things here, but this is called the MitraClip. This is a newer device. This part is detached in the heart, and the idea is you have the arms of the device cinch the leaflets of the mitral valve together, if you can see that.
Yeah, it's hard.
And they actually hold the leaflets together so they don't prolapse or leak. And this is a way we can, in a very minimally invasive procedure, fix a leaky mitral valve, which can also cause heart failure.
Wow. You're right, a lot of information today, but a lot of important information. I mean, just to know that you have the technology available to you, you know, should make anybody feel that much more confident about the treatment options. So thank you, Dr. Fortune. I appreciate you for doing that. Good information as always. And to make an appointment for an evaluation with a Mayo Clinic cardiologist, here's the number to call, 480-301-8200. Go in armed with all of your questions and all of your concerns. And don't forget that ABC 15 is teaming up with Mayo Clinic for the Rally for Red campaign. Each month we're going to give you easy to follow recipes and ideas to help keep you and your loved ones heart healthy. To learn more and get our Rally for Red reminders, sign up at abc15.com/Rally for Red. And in addition to part of our Rally for Red program here with Mayo Clinic, we want to help you relax. Help you relax your heart this summer. Guess what? You can win one of 15 $200 gift certificates from Elements Massage. Sounds pretty nice, pretty relaxing, doesn't it? Here's how you sign up. Actually, go to abc15.com/Rally for Red to enter to win. All right.